He's treated thousands of people. He's written the books. But Dr. Rob Weiss says we're still getting sex and porn addiction totally wrong.
But in the manuals we use for diagnosis, which as you said is called the DSM, we don't have a formal definition of compulsive or sexual problem behavior. So while the rest of the world has criteria, in other words, is acknowledged as a formal diagnosis, the US and Canada have not done that yet.
Subscribe to the Man Within podcast and learn how to be a real man.
Dr. Weiss, thank you so much for carving out some time to be on the podcast.
I really appreciate it. I'm glad to educate wherever I can.
You guys are dealing with the wildfires in Southern California. So you made it work in a hotel room, which I also really appreciate. Thank you again.
My family is with me, and that's the only thing that matters. So thank you.
So you've really established yourself as one of the leading experts in the world on porn addiction, sex addiction. You've written several books. You're the founder of Seeking Integrity, which I believe, if I did in my research, there's 6 locations now, or 6 different treatment centers. And maybe you can correct me if I'm wrong on that, but also, is there anything else that my audience should know about you before we get started here?
Well, I think sex and porn addiction are areas where people kind of say, oh, what is that? Or that couldn't be. Or so maybe briefly explain who I am. I spent the last 30 years licensed with a PhD, very interested in this whole area of compulsive sexual behavior. And my history is kind of opening a little treatment center and thought that would be interesting. And then that led to books and writing, and then led to speaking and being in the media. And, it sort of all rolled downhill. And I think, written a bunch of books and do a lot of lectures and run a treatment center. And it's the evolution of a profession, I think. But also my work, I think, has to do with, and sort of the interest in it is that people have problems in this area and they don't understand them. They don't understand why they're losing their spouses, why they're destroying their careers, why their sexual behavior is so important to them when they are facing so many losses despite that. So I'm very interested in, and do refocus people on how to manage their relationships and manage their lives without this, sort of like alcoholism. I teach people how to live their lives without a compulsive behavior. It could be gambling, could be eating, and sex certainly is one of them.
Yeah, I think you're being modest about your professional development, because not everybody evolves into 9 written books and multiple treatment centers and what you've done. I think the way you're communicating about this topic is really resonating with people, and I think you're very, very good, very clear and concise. So why don't we start with exactly what you kind of were leading into? Porn addiction and sex addiction are contested subjects. Maybe people are misinformed or just underinformed. How do you define those 2 issues?
Well, I think that sex is a tricky issue to talk about anyway. And to be sort of provide a background, for many, many years, there was tremendous discrimination around people's sexual behavior. If you were homosexual, you could be arrested. We're certainly seeing issues with transgender issues. There are all kinds of populations who have alternative or different kinds of than sort of you'd consider typical sexuality. And there was a lot of effort put forth in the field of sexual health to de-emphasize and de-pathologize those issues. So now that we've come against, so the idea has been that sex can never be bad as long as it's healthy and consensual, whether you're into S&M, you're into whatever it is. The problem is that the sexual health field ran into something that actually was a problem related to sex. And that is this compulsive problematic behavior. So the method of helping people to understand, be at peace with their sexual behavior is not a problem, accept it, and that whole way of thinking that helped provide a lot of freedom and comfort for people who felt badly about their behavior. It didn't include the problem behaviors. And so when I talk about sex being a problem, it really strikes a chord in the sexual health community. It also strikes a chord in anyone who's had an affair or, has acted out sexually, and they think, well, do I have a problem? It's certainly an issue with people think, oh, sex could never be compulsive. How could that be a problem? So across the board, the primary issue is a lack of understanding, a lack of insight. I will tell you, without going on unduly, that I've done this for 30 years. And so for years and years and years, the media would say to me, well, that isn't really a problem. I mean, you're making that up, or there isn't any research or stuff like that. In the last 5 or 6 years, or maybe 10, what I hear from people in the media is, that must be terrible. What are people going through? Or what is that like? And so I think the culture has shifted from this is a joke to really beginning to understand that for some people it's extremely problematic.
Yeah.
And we haven't talked
I
about what it is, but we'll get there.
Yeah, well, that was my experience. I mean, I haven't been in this game nearly as long as you. I started out about 6 years ago, but definitely got laughed out of a couple rooms talking about porn addiction and how I wanted to help people in this area. There was just no understanding for it. And I would say, from what I've observed, maybe the last 3, 4 years, um, the world seems to be waking up a little bit, which I think is nice to see. Um, you're making a distinction between compulsion, addiction. I know some of these words sometimes can blend together, but I know you're drawing some lines there. Can you maybe just clarify where those lines get drawn?
Well, I think that the difference is really what does a therapist look at versus what does the general public at some ways. So, for example, we call alcoholism in my field of psychotherapy and in our diagnostic manuals, are taught to call alcoholism a substance use disorder. Well, I don't think anyone goes to an AA meeting and says, "Hi, my name is Joe and I have a substance use disorder." They'll say, "I'm an
Right.
alcoholic." So I think the way a professional might look at compulsive, problematic sexual behavior is the same thing that we're talking about with everyday folks. It's just that the language is different.
Yeah.
But the problem is the same.
Yeah. Okay, that makes sense. And then you referenced the diagnostic manual, which we were talking about this off air. You know, the DSM-5 in Canada and the US, and it does not acknowledge pornography addiction. I don't know. Does it
Or
acknowledge
sex
sex
addiction.
addiction or sex addiction? Yeah.
No.
Gambling is in there. You know, video game addiction, and the DSM-5
Right.
came out in 2013. So you
Behavioral
know,
addictions are in there, except for
right.
sexual behavior. Eating.
So, and then I didn't know this, but you were also telling me off air that internationally, like we are the only countries that don't do this. Like everyone else, the rest of the world seems to be aware that this is a diagnosable condition. So maybe
Mhm.
can you talk about that first? Why the discrepancy?
Sure. Well, I can't speak to. I think there are issues with how North America, in particular, might look at problem sexuality. But the bottom line is that we have manuals as therapists and as doctors and physicians in whatever field of medicine or mental health you are in. There are manuals that explain what those problems are. If you've broken your arm, this is what it looks like. And then a number, like that's number 305 or whatever it is, and that's how they use it for insurance or whatever that is. There's a manual that the World Health Organization uses, and they very clearly state that compulsive and problematic sexual behavior exists and what the signs and symptoms are, and a little bit about how you'd identify all of that. But in the manuals we use for diagnosis, which, as you said, is called the DSM, we don't have a formal definition of compulsive or sexual problem behavior. So while the rest of the world has criteria, in other words, is acknowledged as a formal diagnosis, the US and Canada have not done that yet for various, I would say, political reasons. So if I go to Spain and I say I have this problem, they would say, "Oh yeah, it's called this, and here's the number, and insurance kind of thing." But if I'm in America, they'll say it doesn't exist. And so that has been some of the challenge. What's happened is the World Health Organization has come up with this diagnosis, maybe in the past 6, 7 years, I think, probably related, I think, to internet porn and all the
Mhm.
problems that people were seeing related to the access and the problem that it became. And they were very clear that this is a problem that we have to deal with. It's not something we can ignore.
Why some people, Americans and Canadians, I suppose specifically, would feel so much stigma around the subject. Like, and I'm not saying that internationally there isn't this stigma, but I found that this has been hard for people. Like, why isn't this in the manual, or why isn't diagnosable? Am I really that messed up? It's not even in the manual. That kind of thing. You kind of lightly referenced that there's maybe political reasons that this isn't being added to the DSM rather. Could you elaborate a little bit? Like, what do you think is contributing to that?
Well, I don't know if you noticed my smile as you're beginning to ask this question. I can say that I don't think it's my job. I'm not a politician. I don't write manuals. I don't do research in these areas. So I don't think it's my place to say, well, these are the reasons it's not in the UK, not in the US, not in Canada, but everywhere else in the world. But as I said, I think that there have been a strong effort to create a safe place for people who engage in all kinds of sexual behaviors that are not problematic.
Hmm.
That doesn't really work for the work that I do. Um, and let me say again that I've seen thousands and thousands of people, both men and women. I've created treatment programs. I do know more out of this about this issue than probably most folks in my field. And so I have a deep understanding, emotional understanding, intellectual understanding of what I'm dealing with, where it comes from, what it looks like. But when I went to graduate school, they didn't train us about sex. They never taught us about the organs. They never taught. Now imagine that you go to a mental
Wow.
health program and they will ask you they'll ask you an assessment. You know, how much you eat, how much you exercise, what was your family life? You know, did you have any problems in childhood? How do you feel about yourself? How are your social relationships? And our assessments, evaluations of people with emotional mental health problems in our training go on and on and on. But it's sort of like there's nothing between our belly button and the beginning of our thighs. There are no questions in almost any treatment center that I know of, and this is why I do so much education, that when I'm evaluating someone as a therapist, that I would think about saying, do you masturbate? And how often? Has anyone ever been concerned about your sexual behavior? Do you feel it's ever caused you problems? How do you feel about your sexuality? Those issues simply don't come up. And I think that's part of it, is that therapists in general are not trained to talk about or ask about human sexuality. And so to take it a step further, to be actually talking about problem sexual behavior, um, is a much higher level than most therapists would have a clue about.
And has that shifted at all in the your last 30 years of practice?
In terms of,
Of I guess there just being a better understanding that asking about someone's sexuality is important for identifying their overall well-being and whether they're fit for practice and everything.
I think that in my world, there are people who are much more educated and much more available to do this kind of work, but that's because they've trained after school. That's because they had an interest in this area. But in terms of basic education evaluation for masters, and I would say PhD level, and we don't have to get into all the fancy stuff around all this, but there is really a lack of understanding. In fact, I would say there's a lack of understanding of addiction in general.
Hmm.
Um, we're not really taught in graduate school what addictions are, how they work, how to. They're just areas that unfortunately are not focused on. And which fascinates me as a social worker is if you go out in the world and you're beginning to treat people, guess what their biggest problems are? Drug addiction, alcohol addiction, and sexual relationships. But anyway, I digress, because I think that political and problematic issues around identification are less important to your audience than what are they struggling with? What does it
Yeah.
mean? How does it
Yeah.
affect their lives? Um, so I'd be glad to talk about more of the politics and more of the clinical piece, but I'm hopeful we can get to things that actually help people.
Yeah, yeah, absolutely. So maybe we can start with porn addiction and sex addiction. If there aren't, clearly defined criteria in the DSM, what would you be looking for? What if somebody's trying to figure out, I don't know what my relationship to pornography is. I don't know if it's an addiction, a compulsion, if it's just, healthy and stable. Like I don't know. What's the criteria?
Well, won't speak to the criteria in detail because it's kind of boring if I read through all of it. But I'll say that there are pretty simple signs that there's a problem. And they're the same signs we look at in alcoholism and drug addiction, which means, are you driven to this behavior in spite of consequences? So let's look at drinking. You know, I get a DUI. I've driven drunk with my kids in the car. Alcohol has caused me to lose a job. I think if you're an alcoholic, you would find all kinds of reasons why alcohol isn't the problem. You'd point everywhere else because you want to keep drinking. And so that to me, it would be a typical example of an addict who I think everyone would believe, oh yeah, that person's addicted to alcohol or this drugs. So the criteria for that is really the same for any behavioral addiction. And by the way, I should say there are behavioral addictions, right? We have drugs, alcohol, those are called substance addictions. And then we have this whole other world of behavioral addictions, as you said, gambling, gaming, eating, shopping, areas where people are so compulsive and have such serious problems that their behaviors are considered addictive. Well, except
Mm,
for the sex part. Somehow we've left that out. So the criteria, the symptoms, if you will, of the way we look at any addiction really apply to sex addiction. And those are sort of for your everyday person who's not a therapist, things like, I keep acting in ways that are sexual that are causing me problems, that cause me to lose jobs, that cause me to have huge conflicts in my relationship that might end my relationship, that in some people can cause legal consequences. Now, I really want to be very clear about this. I'm not talking about homosexuality. I'm not talking about uh, what turns me on. I think the best way to say it is sex addiction is not about who you have sex with. It's not about the kind of sex you have. It's not how often you have it. Sex addiction is about problematic behaviors that related to repetition that
Mm.
happen over and over and over again, like any addiction. And you can see that, oh, this is causing me problems, or that yet you can't stop, or you don't want to stop, or you're not able to identify the sexual issues as being the ones that are driving the problem. So the basic criteria for me: sexual behavior is causing profound problems in your life. You are not able to stop them or even recognize them. Um, you have a loss of of goals and life experiences that you're unable to maintain, like relationships, like job. It is interrupted by those kinds of things, and also I think that you've said to yourself, I don't want to do this anymore. I
Yeah.
really don't. And yet, and this is compulsion, addiction, right? And yet somehow I find myself back in that situation that I realize is a problem.
Mhm.
So inability to stop, causing problem behaviors, um, blaming everything in your life other than that problem, and then even if you are aware of it, being unable to stop, even though you're committed to stopping.
I've observed a lot of people are in that category where you said like there's issues. There's issues in the marriage. There's maybe productivity issues at work, health issues, whatever it might be, and then it's blaming everything but it couldn't be the pornography. It couldn't be the compulsion towards sex. How would you help somebody maybe connect those dots and realize that there could actually be a link there?
Well, no one comes to, I've been doing this for 30 years and I have seen thousands of people, both men and women. But no one comes to treatment. No one got to my office by accident. No one comes to treatment. I don't sit around and say, oh, you must have a problem and you must have, that's none of my business. The people I treat come in and they say, I have profound problems. The most common reason that people come in is relationship problems. I'm going
Okay.
to lose my marriage. I'm going to lose access to my kids. Um, and it is on the basis of that crisis. When someone comes to treatment and they say, I want to be a better person, and I say to them, well, didn't you want to be a better person like a year ago? How come you want to be a better person now? And well, my wife, my boss. So people who come to me and to the programs that I run and people like myself already identify themselves as having some kind of problem. They don't quite get it or how it plays out. That's my job, but they know there's a problem.
I think another, again, common misnomer in this space is, it's all about your sexuality. Like if you are addicted to sex, if you're addicted to pornography, we kind of reduce this to a sexual issue. And you and I both know there's certainly more to the equation than that. Can you talk a little bit about when you're helping somebody actually explore the more causal elements? What elements are appearing beyond sexuality itself?
Well, I think I need to go back just for a moment and say that everybody wants to know why. Every therapist, every wife, every husband, every person is acting out. They want to know why, why, why? Why did this happen to me? What is in my history? Maybe I was abused. And to be honest, that is less important to me in the beginning than can you stop your behavior? And
Mm.
that's where the therapist part comes in. I'm very interested in what happened to you and what you've been through and, how that's affected your behavior, but you're still doing it. And so while you and I are exploring your history and your past, you are picking up sex workers and getting arrested. So my focus in treatment is stopping the behavior. The how. How do I do this? How do I stop doing this? How do I find a way to live within my own morals and beliefs? How can I engage in sexuality that doesn't hurt other people? Not physically, but emotionally. And that is the important piece in the beginning. I could show you a video of your entire life and everything that ever happened to you since childhood, and you'd still act out sexually because insight is not really how the work is started at the beginning. It's behavioral. What are you thinking about? Why are you doing this? You say you want this, but you're doing that. And really confronting the ways and the distortions that people have, and then the teaching ways to change their behavior and live differently.
Anything practical there that you're doing to guide someone to stop doing the behavior? Is there anything you encourage?
Well, to start with, I think education. I have a podcast called Sex, Love, and Addiction. We have over 1 million, maybe 1.4 million downloads. People are very interested in what does this mean? What is this about? I would
Hmm.
say that probably 80% of the clients I've seen are heterosexual men who are in a marriage. And those clients are in serious trouble in their relationships. And it's so typical for a spouse to listen to the podcast, read the books, and turn to their husband and say, you've got a problem. And so it is often the spouse that will identify and become experts in this area. And then they're able to confront the person they're living with and say, this is a much bigger problem than you realize. And it's ruining our lives.
If somebody is watching, because we do get a lot of women that approach us and are saying, how do I help my husband realize, like, he's checking all the boxes, he fits the mold here, but it's falling on deaf ears. She can't get through. Any wisdom there?
Well, I think that's about her. What are you willing to accept and put up with? I've worked with women who know they're being that their spouse is having sex with sex workers, having affairs, and yet they're still sleeping in bed together. If
Mm,
I knew about all this stuff and my spouse was not listening, avoiding the problem, saying, gaslighting me, why is it such a big deal and why does it matter? And I'd probably say, well, go sleep somewhere else. In other words, it's the responsibility of the partner to take care of themselves. And as they take care of themselves, the issues change. I guess what I'm trying to say is my saying to my husband, you need to stop this and you have a problem and you're ruining our lives and you doesn't really work very well. What works well is if I'm uncomfortable with something, that I begin to pull into a place of comfort. I don't want you in our home. You had sex in our house, in our bed. I'm going to lock the doors and you don't get to come back. And it has to do with that partner saying, I don't feel comfortable. I
yeah.
don't want to live this way. If you don't want to look at this and it's so deeply affecting our relationship, maybe we shouldn't be in this relationship. So when I begin to take care of myself and address the issues as affecting me, then the addict is stuck with all of that. How can I
Yeah.
continue doing this if it's causing me these kind of consequences?
Yeah, that's really helpful. Makes sense. So I interrupted you there, but when you are helping somebody, that first step you said is just stopping the behavior. Yeah, what does that process look like?
Well, it's a long process, but at the very beginning, I expect them to stop very quickly because the beginning is to identify. What are you doing? Is it porn? Is it sex workers? Is it multiple affairs? Is it all of them at the same time? And then we have to rule out, well, what behaviors are problematic for you? Because I don't
Mm,
necessarily want someone to stop having sex. I think this is where behavioral disorders differ from drugs and alcohol. Because if you have a drug and alcohol problem, you need to stop. You need to stop using and stop drinking. There is no other way around it.
yeah.
But I don't want people to stop having sex. If you have an eating disorder, I don't want to have people stop eating. So part of my job is to begin to define what is the problem, where does it show up in your life, how does it work out away from the way you say you want a happy marriage, but look at the way you're acting. So identifying the behaviors, beginning to really confront their distortions about this is okay, it's not really a problem. Like an alcoholic would say, well, my kids were in the car and I had a couple of drinks, but it was no big deal. And my job would be to say, well, hold on a second. You love your children. You want them to be safe. And yet you're doing this. So
Mm,
I understand their distortions. I challenge those distortions and I make them begin to view this less as something that's okay and beginning to bring into themselves as a real problem. Like I said, a lot of people come to treatment and say, well, the problem is that my spouse doesn't like this. Or the problem is that, if they would just stop this or that. And so they don't realize that the problem is them. And that's really where I have to begin to turn them around.
You wrote a great article in Psychology Today, kind of addressing the question of is porn cheating, and I think it ties into this part of the conversation a little bit because um, and if I understand what you wrote in that article correctly, what you were suggesting is it's not really actually the right question to ask because it's not actually the behavior that creates all the issues of viewing pornography. It's usually the lying, it's the secrecy, it's the hiddenness, it's the fact that you got caught doing something. Those are the things that actually create the issues. So can you for somebody who's maybe watching this or listening to this, they're starting to, okay, they're saying, yeah, maybe I do check a couple of these boxes. I've maybe crossed a line or two. Maybe this is a bigger problem than I realized. How would you answer the question, is porn cheating?
One thing I think that everyone needs to understand, if you don't already, is the backbone of any relationship is trust. The backbone of any relationship is trust. I know, for example, as my husband or wife, in my belief system, that you would never go out that door and do something that would hurt me or cause me harm, that you would always have my back in the world. That is my belief until I find it is otherwise. And once you break my trust, then I don't know what you're doing when you go out that door. I don't know what to believe. I don't know if I believe anything you say. And so without that backbone of I trust and believe in you, relationships fall apart. And so the primary issue in my area is, and I would say this in therapy, is a client would come to me and they'd say, well, the problem is this, but the problem isn't that. And I want to go do this. And I would just say, you know what? Ask your wife. If you leave the house in the morning and you say, I'm going to go see some sex workers today, is that okay with you? And they say anything other than have a nice day, then it's not okay. The people I work with, I think any addict will make up stories, they'll deny, they'll create circumstances where they will gaslight the partner into believing that they're trustworthy, that they're honest. They don't want to deal with the consequences and they don't want to stop. But the bottom line is that once I find out that you are doing something in a meaningful way and not informing me, then there's a problem in the relationship. And if you can imagine a spouse, we're not talking about someone who looked at a little bit of porn or someone who even had an affair. We're talking about, in my world, people who look at hours and hours and hours and they lose time. They're no longer sexual with their partners. They view the world in a completely different way because they're so sexualized. But the most important thing is, I'm really touched by this statement. I've had partners who say, you know what? If you told me in the beginning that you had a problem with porn, I would have helped you. We could have worked this out. But here we are 15 years later, and we have two kids, and I had no idea who I was marrying. I
Mm,
didn't, and I have no idea who you are. And then I have spouses say, I don't know if what we've had was ever true. I certainly
mm.
don't know if what we're going through now is true. I don't know you. And so that lack of belief in the person, the loss of trust and connection, really it's the lying. If you would just now, if I told you the truth and you leave me, okay, that's one way the relationship might work out. If I tell you the truth and you say it's fine with me, well, that's another way it might work out. But if I don't tell you, if I'm hiding it from you, if it's so important to me that I'm going to keep secrets from you over and over and over again, that's when it becomes a real problem.
I know one thing we've really tried to encourage our audiences is kind of the difference between getting caught versus confession, or having that proactive approach. Because even though you're relaying very difficult information
That
and
will
information,
never happen.
what's
That will
that?
never happen. I will never go to voluntarily my spouse and tell them what's going on. Never, ever, ever. Because I don't want to get in trouble. I don't want them to be upset with me. I want them to think I'm trustworthy, fair, and I want to keep doing what I'm doing.
Yeah.
What will happen is a spouse will find something out. And they'll say, is there anything else? And I'll say, oh, no, no, no. That was absolutely it. But I'm lying. And so
Mm.
then a spouse will find something on a phone. They'll find something, some communication, an email, and they'll say, well, wait a minute. You said it was just this, but I'm noticing that. And so what an addict will do is they'll only say as much as the partner knows and no more. And so they are trying to continue to get away with what they're doing in that way. But actually coming to someone and saying, I have a problem, why would anyone say that if they want to keep doing what they're doing and they don't want to get in trouble for it?
100%. Yeah. And I think those caveats are important because we definitely have people who have made the brave, decision to have that conversation because they are wanting to change and
After they get
everything else.
caught. Well, but yeah,
Yeah.
but they have the
Well,
conversation because they're in trouble. Something has
yes, they're in
happened.
trouble. Yeah, it's not always that they've been caught first, but yeah, they're definitely in trouble. Like they've approached this red zone.
Something has happened, and I'll say again, I have never seen anyone ever in my entire career come into treatment and say, well, this is bothering me, so I want to stop, or I don't feel good about myself, or I want to be a better person. And then I say, what happened in the last week, 3 weeks, 6 months that has left you so concerned about this that now you're seeking help?
If somebody's in this position, they're in a committed relationship, there's betrayal and there's distrust now that's been created by the issue. When somebody goes through the recovery process, what do you recommend as far as also you know trying to mend the relationship or get things back on track? Is recovery kind of that first step, and then you focus on the relationship, or what's your approach?
Well, I don't think you can heal any relationship while there's lying and secrets and cheating and all of that stuff. So I have to stop the behavior. You have to stop doing the thing that's causing the problems. And then you have to really begin to be honest with yourself about what it's about and then seek some process of taking care of yourself. Relationship healing in these circumstances, a year and a half, when people will just begin, where a spouse will just begin. I mean, spouses are enraged. They feel violated. They, and this doesn't go on for a week or two. This isn't, I know I had an affair for 3 years and I was sleeping with, having sex with sex workers for 5 years. And like, this isn't like if I give you a little bit of jewelry and I take you out for a nice dinner and maybe go on vacation, this is going to be better. I don't
Hmm.
think one of the problems that addicts have, and I did write a book about this called Out of the Doghouse, a relationship saving guide for men who are caught cheating, is that men in particular don't have any understanding of the depth of pain and violation and loss and betrayal that a woman will go through when her experience of her partner is when she's being violated over and over again. And men think, well, a little of this, a little of that, it'll all get better. Or it's been 3 months since I cheated on you for 12 years. How come you're not over it yet? And so the relationship healing is a long-term process. And addicts lie. Addicts make up things, they hide things. So a spouse will say to me, how can I ever trust that they're beginning to change, that I could ever trust them? And I will say, you can't trust anything they say, not a word. They've probably said to you many times, well, I was really here and I was really there. And you can't trust what they're saying. What I would say is, can you trust what they're doing? So we make recommendations. We want you to go to 12-step meetings to get support from other people who have the problem. We want you to be in therapy for these issues. We want you reading books and taking courses. At Seeking Integrity, we teach courses about what is sex addiction, what is porn addiction, taking them through workbooks and all that stuff. They have to begin to take steps, concrete steps toward beginning change. And if I were a spouse, I wouldn't listen to a word.
Hmm.
And I think also the job of a spouse is to get support for themselves,
Okay.
to understand that they've been giving and doing. I think one of the things I hear from partners most often, well, let me say it this way. It's really interesting to me that we often, in treatment, we will have a spouse send in a letter. And we want to read that letter to the patients, to all the men who are there, and have them hear the experience of the spouse, what this has done to their relationship. And what fascinates me is I always thought that those letters would be 80% about sex. Because after all, you sexually violated me, you were cheating, you were lying. 75% of them is about a lack of intimacy. You were
Wow.
disconnected. You weren't really there. I would ask us to talk about issues and you'd put me off. You would blame me when I wanted more time with you and say, don't you understand how busy I am? You wouldn't want to engage in meaningful ways in the relationship about our problems or my perceived problems. Um, so I think long before the sexual acting out is discovered, spouses will begin to say there's something not right about how we relate to each other. Um, on the other side of what you're saying, intimacy is not sex. Intimacy is connection and being open and vulnerability emotionally and physically. And all of that leads to healthy sexuality in a partnership. Um, so just to sum up what you're asking me, I think the person who's acting out needs to come to terms with the degree of harm they've caused to their partner, to their family. And the partner needs to begin to say, I've been victimized by this. I've been violated by this. I've been abused by this. And I'm not saying they're being raped or they're engaged in non-consensual behavior. I'm saying that all this stuff has gone on that I knew nothing about. And you lied to me and you gaslit me and now I'm supposed to somehow trust you and or be intimate with you, and that takes an awful long time, because how could you trust someone in those set of circumstances when they've been lying for 15 years? And I've got to tell you, I work with clients who are in their 60s and their 70s, honestly. Um, Not always that age, but all around the block. But it always surprises me when an older person comes into treatment. And they come into treatment because they have been acting out for 25 years. Their entire marriage and their
Hmm.
spouse knew none of the specifics. They never knew, why are they not intimate? Why are they connecting? Why did they leave during our honeymoon and go out for 3 hours? Why is it that their phone keeps ringing or they keep looking at their phone? Why are they lying in bed and saying, I'm just working on a crossword puzzle. I don't want you to look. There are signs over and over again, but it's hard to put together until you have actual facts.
So you've been treating people for a long time. When you talk about, helping people go through a recovery journey, again, we've kind of talked about some of the earlier steps. I'm curious, when you think about like helping a client rebuild that trust or, learning to have empathy and understanding for their spouse or their partner, some of those building some of those, I guess, foundational relationship skills that contribute to intimacy, like we're talking about, is that part and parcel for recovery, or
But
Are those
that is
things that you've done
so
separately?
far away from anything I have to talk to these partners about. They're going to lose their relationship. They have destroyed everything that is important to them in their intimate life. They have violated their spouse with lying and cheating. And the idea of restoring intimacy and trust is a long way away. Spouses have to grieve. They have to become furious. They have to understand their violation. Intimacy and trust is it comes in little teeny pieces. And what makes perfect sense to me is I'll give you an example. I worked with a couple that were doing wonderfully. He was not acting out. He was doing the things he needed to do. She was taking care of herself. I was working with them. We thought everything was going great. One day, his wife asked him in the morning, "Would you mind taking out the trash today? It's really important." And he said, "Absolutely. I will take out that trash." And she came home in the evening. He said, "Check out the trash." "Oh, yeah, I took it out," even though he never did because he feels bad about it or doesn't want to get caught. And that spouse walks into the bathroom and she looks out the window and she sees her husband, you know, gently taking the trash thing out so she won't know he didn't take it out. And I had a spouse who said, "I'm done. This relationship is over." And
Wow.
he'll say, "Well, I've done this and I've done that." And she will say, "You know what? If you can't be honest with me about the fact that you didn't take out the trash, how could I ever trust that you would be honest with me about the more important things?" And so
Wow.
when someone is in this situation, when the couple is in this situation, every single thing matters. Being defensive. If you say to me, "Well, I don't like that you were you say you were at the grocery store, but I don't believe you. I think you're going back to your behavior." For me to say, "No, I'm not. And I don't know why you're accusing me of that. And you know how hard I've been working. And I can't think of a way to make your partner angrier and feel more violated. If you want to rebuild intimacy and you're 20 minutes late from that grocery store and your spouse is saying, 'I know you were cheating. This is what you were doing all the way along. And you really weren't this time.' The response to your spouse, if you want to build intimacy, is, 'I can't imagine how hard this must be for you. I
Mm,
can only imagine when I'm 20 minutes late that must remind you of everything that we've been through. I am so, so sorry that I leave you in a place where you can't trust me.' Um,
mm.
I could say, 'Well, I spent half an hour at the grocery store and I raced home from work and there was a lot of traffic.' And that may all be true, but it
Yeah.
invalidates the partner's experience of a lack of trust. And that, by the way, is the number one thing that every spouse wants: honesty. Every single one. I just want to know what's happened. I don't know how to lead my life. I don't know how to go forward. I don't know what we are until I know what's been going on. And addicts tend to not want to talk about all that.
Maybe I'll ask this from a different angle. For
Did I
somebody,
not answer that right? I'm sorry.
no, you answered it beautifully. But there's another part that I think I want to extract from this.
Sure.
Somebody is they're going through recovery, some kind of recovery protocol, and there's been trust broken in the relationship, and that example you just gave, maybe early on in recovery, they don't even have the ability, they don't even know how to empathize when that kind of a conversation comes up. How does somebody learn that empathy? How does that get developed in the recovery process?
Well, I think in the beginning you have to understand what you've done. And I think you have to understand the harm that it may have caused. I think you need to learn how really understand what your partner has been through and begin to understand how you have affected them. And then you can begin to think, wow, that must have been really hard for them. That must have been really difficult. It's interesting. I have men come to treatment because we run a treatment center, right? I only see 8 clients at a time and we're residential. I'm very invested in the clients having intimate non-sexual relationships with other men because they're chasing whatever they're chasing, even if they're chasing men, but they don't know how to be intimate and relational. But anyway, when I start to bring up the challenges, you've been doing this, you've been doing that. What is it? Do you realize what's done to your family or whatever I say? And then they'll say things like, "No, I'm such a terrible person. I hate myself. How could I do these things? I'm so ashamed. Me, 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 me." That's not empathy. That's selfish. That's, "I feel bad about it. I'm just going to point the finger at me and continue to focus on how terrible I am." Empathy would sound something like, "I can't imagine what I've put them through. I can only imagine how much hurt and loss they may be feeling." So it's interesting because, us therapists, we're really encouraging people being emotionally available and getting in touch with their feelings. And I have seen men tearful about how horrible they are. And I'll say, "Could you cut that out? No therapist. Could you just lower the alligator tears here and let's talk? Let's stop talking about you and
Hmm.
how bad you feel, and let's talk about what you've done to others. And so, to me, that is a line between narcissistic obsession. It's all about me. And the beginning of what you're talking about was empathy, is understanding how what has happened is affecting you.
I'm guessing there's some prompting there. Like there's you have to kind of like steer the conversation there to start to develop that, even just that awareness, right? That understanding.
Oh, there are all kinds of ways that we have to do that. Many men who are married and have kids will come in and they'll say, well, I know I've been a crappy husband, but I've always been there for my kids. I took them to the game and I did this and I did their homework with them and I spent all this time. And what I'll have to say to them, and this is often very painful, is you probably haven't been the best father you could have been. Not at all. Because if you're a man who has left your spouse feeling anxious, abandoned, confused, emotionally unavailable, how can they be the best mother they could be? How can they best be the best parent? How could you possibly be fully emotionally available to your kids when you're doing all these things that are secret? And I think for many of the men I work with, that is really the bomb. It's one thing to say to the spouse who's been furious at me, well, they're just going on and on. But to look at your kids and say, wow, they have been really harmed by my behavior. I had one wife, and this really deeply touched me, who said, I put on a face of, happiness and everything's fine with my little kids because I don't want them to understand and feel how much mom struggles. And I think I do a pretty good job of that. And I'm talking about little kids. But then I had this mother say to me, but the hardest part about me is I don't get to enjoy being a mom. I don't get to enjoy my children because I am so focused on trying to be something to keep them safe,
Wow.
that I don't get to have my own experience. And I'm not saying that you shouldn't tell kids that mom and dad are struggling or there's some issues or you're working on things, but you know what's going on.
Hmm.
So when these men that are married in relationships really fall apart and really begin to look at themselves is when they have to realize the effect on their family. Well, let me add something else. There's the single guy or the single woman, and they're spending hours and hours and hours looking at porn or sexually acting out. They have life goals too. Maybe they want to be in a healthy relationship. Maybe they want to have a family, gay, straight, whatever. Maybe they want to develop intimacy with someone that they might care about. They're not available for that. Their focus is the porn. Their focus is the acting out. And that availability, that connection to a potential partner isn't really there. And I've had men say to me, dating is hard. I mean, you don't always you never know if you're going to get sex or not. You have to take the person out. You have to spend time with them. Sometimes people smell a little funny because they've spent 90% of their time looking at porn. So their distortion, they don't even know how to have a date. They don't even know how to
Yeah,
begin
it's true.
because their time has been focused on this over and over and over again.
Yeah, well, I appreciate that distinction, right? Because I think it's easy to reduce this to people that are married or have kids, but yeah, there's a completely different side of it when you're single, and it's just as damaging.
You asked what the underlying problems are related to this issue and how it comes about. And I can tell you again that the reasons in the beginning are less relevant to me than stopping the behavior. But there will be a point if someone has really managed to find a way to stop that behavior and live in a healthier way that we will begin to look back and say, well, gee, I wonder how you ended up like this. What I often say, in fact, always say to the men I work with is, if you mean to hurt someone, if you mean to cause them harm, if your intention is to hurt your spouse and your family, I can't really help you.
Yeah,
Did you intend to help them, hurt them? Did you? And of course, their hurting them was inadvertent. They didn't understand or grow up understanding empathy, compassion, insight. There's a tremendous issue around enmeshment, often with a parent, where kind of the needs of the parent supersede the needs of the child, and they don't really learn a whole lot. They miss a whole lot about the beginning of relationships and forming relationships and safety in relationships. Certainly, I've worked with a lot of people who have all kinds of abuse in their history, but not everyone who has abuse necessarily turns out to be a sex addict. I think there are
yeah,
certain kinds and patterns of abuse, which I could pretty much name, but I don't think they're relevant at the moment because that's a part of treatment is to really help them gain insight, but more to say that there are early problems in relationship, early problems in learning what trust is, early problems in learning that I can rely on someone versus I can need to rely on myself. There are all kinds of ways that children learn what a relationship is and what
Mm,
trust is and when to be vulnerable. And I think most of the people I work with learn very early. They can't depend on anyone. And their way of being soothed and comforted is to take care of it themselves. And
right.
and some children will find out that rubbing themselves on the bed feels good or touching themselves feels good. All children, while not sexual as adults in the way we perceive it, do have warm and comforting experiences. And so if you use sexual fantasy or that experience of comforting yourself in this way and using fantasy without the reality of getting the kind of support you need, well, you would learn that the way I feel connected and comfortable and safe is not reaching out to other people, parents, because they're not going to be there for me or they're going to hurt me or they're whatever that is, but I can depend on myself. And that kind
Mm,
of solo focused, I have to take care of me, that leads to all the lack of intimacy and the compulsive behavior and the hiding and the lying, because on some level, I'm doing something to help me feel okay, to
right.
help me feel stable. The consequences of that are enormous. But this is something I've done my whole life is find distractions and ways of comforting and soothing myself that don't have to involve the possibility that someone's going to let me down. As an adult, I never want to re-experience what I experienced as a kid. I don't want to feel neglected. I don't want to feel abused. I don't want to feel whatever it is. But so my primary relationship is with the behavior. Because when I am sexually acting out, if let's say I'm seeing sex workers, they're not going to criticize me. They're not going to let me down. They're going to tell me I'm the best person in the world. But a real relationship means being disappointed, means not getting your way, means feeling abandoned. And those are feelings my clients do not want to feel. So they
Mm,
keep this emotional distance from the people they love. And that's the lack of intimacy I talked about. And then they have this whole other life where they feel most alive and they feel most connected. And really, I would say they feel most distracted. The problem is that they're living compartmentalized lives where there's my sexual life over here and my family and relationship over there. And
yeah.
the healing in part, and the reason that we call our program Seeking Integrity is that the word integrity comes from integration. And it has to take with taking different parts of myself and really bringing them together. I don't anyone to ever know or see something in my life that would say I had no idea that he did that. Now, I don't want you to see me in the shower. That's my business. But the fact that I shower shouldn't surprise you. I may flirt with someone sometimes or do, but the fact that I'm having affair after affair after affair, um, I keep that part from you. And so I have no integrity because I am acting and living in all kinds of ways that have nothing to do, that are separate from what are supposed to be my intimate relationship.
And I think that's really like what recovery is all about. Like I love the definition of integrity, right? Like it is that integration of self. There's not this kind of, split or compartmentalizing, like you're saying, like and I think that's what we were talking about earlier, right? Like there's no secrecy, there's no hiddenness, not just to the people around you, but I guess maybe even first with yourself. Like you're just confronting the realities of who you
Right.
are and what you've done and having an integrated approach. I want to ask you two follow-up questions from what you just said. One of them is you talked about how when people are dealing with addictions, they can become very self-focused, right? It's me, me, me. And even if you're on the other side
Absolutely.
of the wallowing and everything, it's still very self-focused. How linked are addictions, especially sex and porn addiction, with narcissism?
I think they're essentially connected because when you're a narcissist, you are the center of the world and you believe what you're doing is fine, and you will argue and disagree with those who don't see you in the way you want to see yourself. As a narcissist, I lack empathy. It's one of the key signs of empathy, of narcissism, which means I can do what I want to do when I want to do it, and I'm not even aware of the consequences it might have on you because my
Mm,
focus is so on myself. Most of the people I work with have narcissistic challenges. They're not necessarily narcissistically disordered. I think the big terms, the big psychiatric terms about, profound narcissism are not necessarily what I'm dealing with, but I am dealing with aspects of how the way someone's narcissism plays out that I can say, I love you, and then I can completely do things that would hurt you. And I think that I can carry that off. And I think that you will feel it's all about me in that way. The behavior is narcissistic, and I act narcissistically. And I think the key to narcissism is really a lack of empathy. is a lack of empathy for the other person. And that's where you're talking about healing relationships, is not me saying, oh, I didn't mean to do this and I didn't mean to do this and I'm a terrible person. That is narcissistic self-obsession, what you might call shame. When the person turns toward the other and feels empathy, that is the way out of narcissism. And that takes a long time. I can
Yeah.
stop people from sexual acting out, but helping them become a better person, that takes a long time.
Yeah. Um, so kind of an offshoot. And my second question, just following up what we were discussing a few minutes ago, you're talking about enmeshment and sort of there's a duality, right? There's enmeshment, and then there's also this kind of independent spirit that can develop depending on, your early childhood experiences. The specifics of that maybe not so relevant, but what I wanted to ask you is, you wrote a book called Prodependence, and really trying to shift the language and the perspective around codependency in this conversation. Can you just talk a little bit about that and why we shouldn't be maybe using certain language, or what do you mean by prodependence?
Well, I'm glad to talk about that because I don't really believe in the concept of codependency. Just from a clinical perspective, as a therapist, there has never been a diagnosis. It's been around since the 80s, and we've never proven it. There's never been research. There's no formal understanding. It's not in any of those manuals. So really what codependency is it's a pop culture topic about being overdependent and helping someone too much and leaning too much into them and depending on them in a way that makes you feel bad if they're feeling bad, and there's something wrong with that. And you should be more independent. You should be able to focus on yourself. All of this idea of what we call in my field individuation. And I think what's happened is the field of mental health has shifted. And my health is not just about me. It's not just about my ability to function in the world. My health is also defined by the quality of my relationships and the quality of connection. And, when a spouse comes in and their husband, their wife has been drinking alcoholically and ruining their lives. And that spouse does everything they can. They stop working, they gain weight, they read everything about it, they become angry, they become irritable, they become demanding. And those are the ways we would look at their codependency. In other words, that's the way we would blame them and say, why are you so involved with that person? Why are you letting them take so much space in your life? Why don't you realize that the way you grew up meant over dependency? And I think the way I look at it is, when someone comes to my office and they say, my life has been destroyed by this addict and look at all these crazy things that I've done, I would say, of course. Why wouldn't you, considering what's going on in your life? You know what? I think you're a hero. I think as a partner to have put up with all this lack of intimacy and disconnection, I think everything you did was right. I don't care about what it was, whether it was nagging or following the person around, or whatever the behavior is or even reenacting things from the past. Why is that behavior there? Is that there because someone is struggling with their own issues and how overconnected they are? Or are they struggling with the response to what they're living with? So I'm going to give the most supreme example of what would go against the codependency model in some ways, which is, let's say I'm working with a wife whose husband is alcoholic. It's a good example. And as I said, he drinks with the kids in the car. He's lost a few jobs. He even got a DUI and all of that kind of stuff. Meanwhile, she's working 3 jobs. She's gained weight. She's given up on her exercise and self-care. She is nagging and complaining and demanding because her life is out of control. And the very person that she depends on to be supportive, to be nurturing, to help is not only not helping, but they're completely unavailable. So I had a spouse who said, and I just love this. She said to her husband, you know what? If you could not drink until 4 p.m, you see that ice cold bottle of vodka on the table every night at 4 o'clock. That'll be there waiting for you. I can only imagine what the codependency and all of those folks would say. She's enabling, she's supporting, and what I would say is, how clever of her that for a period of time she had the man she was involved with not losing jobs, not driving drunk, and taking her kids to school without drinking. Now, as a long-term solution, that's going to fail too, because eventually he'll start drinking during the day and all that kind of stuff. But I don't consider her as having a problem. I consider her as having done everything she can to protect the health of her family, even if it means that she has given up huge parts of herself. Now,
Yeah.
codependency would say, why in the world would she give up all kinds of parts of herself? Why would she put that bottle on the table? What's wrong with her? She's trying to keep her family together. She's trying to
Mm.
make it work. And I got to tell you, if the person you love is failing, you are going to take up the rest of it. If you had cancer, I would work double time. I would have all my friends come help me. I would talk about the issue. I'd read every book. I'd probably lose weight. I'd probably get overwhelmed. This is the challenge with mental health. But if you have an addiction, then there's something wrong with me for staying with you, for loving you, for nurturing you, for being there for you. And it's something wrong with me. Why would I stay with someone who's caused me so much pain? It's not because there's something wrong with me. The reason I stay is because I love them,
Yeah.
because I can see the best parts of them, because I believe in the possibility of our healing and going forward. I don't stay with you because I want to hurt and be miserable. I stay with you because I care about you.
Mm.
Relationships, I've worked in domestic violence shelters where a woman might be beaten and hit and come in black and blue and all of that stuff, and she's in a shelter. And she'll look up and say, I don't understand why this person who's done all these things to me, that I still care about them. And the answer is, you don't stop loving somebody or caring about somebody because they've hurt you or harmed you. The love, the connection is so much more powerful than what's happening right now.
I think I appreciate that take, because I think a lot of people do end up shaming themselves and probably heaping way more guilt on themselves than is worthy, when you're right.
That's what the
Like,
culture says to them.
right.
I work in a treatment center where the addict, sex addict, partner, gambling addict, alcoholic, whatever it is, and they finally got into treatment. And everyone is so relieved. They're getting better, they're working on themselves. And then the family group starts. And the family group is not about what the partner feel might happen, or which is good for you for hanging in there, and this must have been hard for you, and how hard you work to keep your family together. They don't get validated. They are finally in a situation where their addict spouse is getting help, and they walk into a room and the therapist say, let's talk about what's wrong with you. How is that helpful to them? How does that support them? How does that nurture them to now ask them to turn on themselves and look at everything they did wrong that supported this problem?
Yeah.
So to me, codependence is about a very different stance. Instead of saying nagging and complaining and, rescuing is a problem, I'd say, of course, when you love somebody, you would try to nag and complain and change. You don't want to live this way. You want things to get better. You love them. So in codependence, I am leading into the fact that this partner has been a hero
Mm.
and that they've done everything under the sun to try to get that person healthy because they love them, and even to their own detriment. And I
Yeah.
don't want to blame them for that. I want to say, wow, it's amazing how much you love this person and your family, that you would give up of yourself to make it better. Codependency says, what's wrong with you? Why aren't
Yeah.
you just taking care of you?
Yeah.
So, and there's lots of reasons from the culture, where it came about and what it's about, codependency. And I could give you chapter and verse. In fact, I wrote chapter and verse. But the bottom line for me is that I believe that partners and family members should have a lot more respect, that we should be a lot more compassionate toward their healing and their own issues, not blame them.
Mm.
May I give one more example? I know I talk a lot, but that's
Please.
sort of me. So I write books, and I sit in those little book lines sometimes where people come along. They never buy your books, by the way. They bring in an old book that they bought 5 years ago and
Oh,
have you
yeah.
sign it, or you're sitting there in the book line by yourself talking to the other people who are selling books, whatever. But since I've been talking about codependence, I have lines of people, and
Mm.
they come up and say, I've had a number of women come up and weep and say to me, for years, I was told that on many levels, I caused the death of my child. And I've been
Oh.
carrying that weight of I'm codependent, I've done this and I've done that. You're the first person, me, who said to me that maybe it isn't my fault. That maybe did the best that I could.
Wow.
Maybe all the ways that I did it weren't perfect, but it came out of love and care. And they are weeping because they spent 12 years thinking that it was their fault. And why did they feel that way? Because of codependency.
I guess it's worth asking the question, since we use the word so much. What is recovery?
Well, in the most basic sense, recovery is absolutely taking a very clear and hard look at what I've done and what it's cost other people. That's the motivation. I cannot help somebody. I can help all kinds of people in treatment with all kinds of issues, but the one thing I can't help them with is motivation.
Hmm.
So when I see that that person is beginning to take responsibility for their behavior. Their spouse, it isn't their spouse nagging. It isn't their spouse saying, why didn't you go to the support group? And why didn't you go to that? I see someone recover who's taking responsibility, not only for what they've done, but for a consistent way of beginning to heal it. The men and women I work with, they have a lifelong problem. Because there's a lot of things that underlie it. And like anyone who has an emotional or mental health problem, when things like depression, when things are stressful, when I'm going through a hard time, I might go back to drinking. I might go because I have a lifelong problem with the need or the feeling I have to escape stress rather than dive into it. So in the same way, recovery to me is about someone who's committed to finding a path and maintaining a path that leads to change. And not only when they've just stopped the behavior, but continuing not only to help themselves, but help other people.
Yeah.
There are books to read. There are courses to take. There are things to learn. There are ways I can go to endless support meetings online right now. To me, recovery is that I have made a commitment within myself to grow and to not hurt myself or other people in this way. And I haven't just made a commitment. I actually am showing action on a regular basis that I am doing this. And you asked a question about how relationship trust has been restored. It is restored when, as a partner, I see this person in recovery. And that means I see them engage in consistent actions that they know are going to help them stay stable and out of this behavior. When they've taken responsibility for it, to me, that's recovery really is.
It's such a great conversation with you, Dr. Weiss. I'm so grateful for your time. For people that do want to find out more about you, what you're up to, what's the best place for them to go?
Well, I think we have pulled everything into a site called seekingintegrity.com. And yes, we do a lot of lectures and workshops. Yes, we run a residential program. But I really believe strongly that most people never get to therapy. Most people never have the resources to go to some kind of treatment center, or they may not even have time to go to a 12-step program. So one of the things that I've done is we've created 14 or 15 groups where people can just go and learn. A betrayed partner, an older betrayed partner, a gay man who's acting out, a spouse who's thinking about divorcing, spouses whose children were grown in God. We are offering opportunities that are managed and overseen by therapists, moderated, not therapy, for these people to come together and talk about the problem. Because it is in my cohort, is in the people who have the same problem as me, where my healing will come about. I am sitting with 12 betrayed women. And I always thought I wasn't attractive enough. I wasn't sexual enough. What is wrong with me that he or she went off and had sex with all those people? And then they look across the room at someone else who has the problem and they say, well, they're fairly attractive. They're fairly, intellectual there, or they've gained weight. How come that happened to them? And then they begin to realize that it isn't their fault, that this is a problem that has to do with the other person and how it's affected them.
Thank you for your time, Dr. Weiss. We will put the links as well that you mentioned in the show notes. Just grateful to have you here today. Thank you again.
Yeah, it's my pleasure.